welcome to another video on my channel. Today's video is going to be another video in partner with Nurses.co.uk, and I'm going to be talking about things that I wish I knew before starting nursing school. There is a lot of misconception about the course. It is completely different to what I expected. I didn't really have a picture of it really. I just knew of what my mum had told me because she's a nurse as well. So the first thing is that nursing is not just like hospitals and wards, like drug rounds and all that kind of stuff. There is a lot of things you could do as a nurse, so many different opportunities. I kind of thought that it was just mainly hospitals, but actually a hospital ward is like one of the hardest placements or places that you could be. The second one is that it is harder than you think. I heard a lot about stuff saying that the nursing course is easy, and to be honest with you, all of the lecturers say it all the time, and I completely agree, is that it is genuinely the hardest degree at our university anyway. We don't take on medical students, so obviously medicine is going to be a lot harder than nursing, but I would definitely say that nursing is like the second hardest degree that you could probably do, and it's definitely not easy. So if anyone tells you do the nursing because it's easy, it's not at all. And there is a lot of people that drop out mainly because of it's not what they thought it would be, basically. The third thing is that I wish I'd have known that every single lecture actually means something and that we're being taught it for a reason. We don't even get told what the lecture is usually for. We usually just get given the information, and then later on when you're doing like an assignment or an exam, you're like looking back on the lectures thinking, so that's what this lecture was about. And I also wish I knew that I probably should revise after every lecture, because they only skim the surface on the subject when they do teach a lecture, especially the anatomy and physiology ones, and to actually get to grips with the subject you have to revise after the lecture and really make sense of it yourself. The fourth one kind of ties in with the last one, and that is that you don't get taught everything at uni. In fact, you probably get taught like a quarter of what you will know at the end of the degree in lectures. Most of it is self-taught, basically. So what you personally come across in placement, not what your mentor tells you. It's usually what you personally come across and what you decide to research into and all of that stuff. So I wish I'd have known that at the beginning, because I'd have definitely researched a lot more. And you can't use the excuse when someone asks you why you don't know something, you can't say I never got taught it, because they will just look at you gone out. I wish I'd have known that you have to really put yourself out there as a student nurse, and that's in terms of mainly learning and like knowing your place, because a lot of times you are kind of ignored slightly, especially in hospitals, unless you get a placement like in the district or in a small area. In the wards you're generally ignored, and a lot of people that aren't nurses will not know what your degree expects from you and what you're there for. Like med students, they don't have any idea, like, so the doctors or even the HCAs don't even know what your course is for. Like, they don't know what you're supposed to do on placement or anything, so you really need to know what you're there for, where your place is, and not to be treated like a HCA. And you really need to know to kind of go to different wards if you need to. Like, if you're getting really bored and you don't feel like you're getting anywhere on your placement, speak to your mentor or the ward sister and be like, I need to go to a different ward to learn more because I don't feel like I'm learning much here. And yeah, just to put yourself out there in terms of that, and not let yourself get looked down on at all, because sometimes that happens. And the sixth thing is that you can impact a patient's life a lot more than you think, because that might have been their only experience in hospital ever, and you might shape their entire opinion on the NHS. Just know how you can impact their life. Seventh is that universities value experience a lot, and I mean a lot. If you've been a HCA for 15 years and you've gone back to college to get your access to nursing and then you apply for uni, you're pretty much going to guarantee a place. However, if you was like me and you came straight from college and so you don't really have any work experience as a HCA or in healthcare whatsoever. Unless you've got like straight A's, you're probably going to get declined. So that's why I'm super glad that my college told me that I need a lot of work experience to get into the hospital. And because I didn't have a hospital near me, I just kind of volunteered at the local primary school, and I also volunteered at a learning disability club for children because I wanted to be a children's nurse back then. And that kind of boosted my application a lot because I did that for about 2 years whilst I was at college. Again, tying in with the last one, the 8th one is that it is very competitive to get into uni. A lot of people again say that it's a lot easier to get into uni than other courses, but it's actually probably one of the hardest again to apply to and get into. A lot of courses have like 100% like acceptance rate, probably because they have hundreds of students, and I don't even have that many people apply to the course. But nursing is completely different. They probably only have like 100 spaces and there's only like one course at every uni. And if you're applying to like mental health or children's nursing, they have literally like 20-30 places for each of those courses depending on what uni you go to. But yeah, it's really hard to get into, and anyone that tells you that it's easy is definitely lying. The 9th one, wait, that's 6. The 9th one I think we're on is that assignments and exams and whatever else take a long time. You can't just wait 2 weeks before an exam to start revising, and you can't just wait 2 weeks before an assignment's due date before you start writing it. Some people maybe work like that and can do assignments and exams really fast and just inhale all the information and write really fast or whatever, but honestly most people I know have literally started revising for exams months before. Like as soon as they give us the exam, they start revising for it. And the 10th one is to start everything early. Again, it ties in with the last one, and be organised. I wish I knew to be very, very organised, because at college I didn't think I was that organised, and it really showed in first year when I wasn't really that organised. And so at the beginning of the year, this is my first week of third year, so I'm going online and looking at all of the modules and the exams and assignments and knowing them, just kind of expecting them. And I wish I'd have done that all the way from first year really. And the last one, the 11th one, not everyone, just because you're going into nursing, not everyone is going to be nice and not everyone is going to be mature. Me and my friends have had this conversation loads. If we've had a negative experience, we're like, I would never think that a nurse would be like rude, or I never thought a nurse would be immature or anything like that. And even people on your degree as well, just because they're doing nursing, it doesn't mean that they're super nice, down to earth and all of the other good things, because there is a lot of people that are not like that. So yeah, they're all the things that I wish I knew before starting this degree. Yeah, that's it for the video. I hope you enjoyed it, and I'll see you in my next video. Bye!